All right, so now we have two different plexi in the lumbar spine. Okay, what are those? We have the lumbar plexus. There's a couple things that are significant with that. We have this lateral femoral cutaneous. So those are the ones that are coming out up here. You have the lateral femoral cutaneous nerve right here that goes under the inguinal ligament. So right there. And we'll talk about that. You're going to get some impingement there. And then what's the other nerve that we talked about on the front? Femoral nerve. Okay. And so then here's the distribution on the femoral nerve. And then it does, part of it does continue down into this area here. So again, it's the same thing like in the cervical. You know, you can have nerve roots, which when the symptoms manifest onto the skin for a nerve root, what do you call that? What's another word for skin? Dermatome. Okay, so then you're going to have peripheral nerve root distribution. So we talked about peripheral nerve root distribution. What's this here?
Median.
Right. So then we have the same kind of things in the lower body, right? If we're going to talk about here, what's this? The lateral femoral cutaneous. But then you also got to be aware it could be a dermatome from a lumbar nerve root. So dermatomes and peripheral nerve root distributions are a little bit different. So you have the femoral nerve here, and then when we get into the lumbosacral plexus, what's this big bad boy right here? Right. Okay, so then that's part of the lumbar sacral plexus. So you got L4 to S3. So then here's the peripheral nerve root distribution here. It's pretty much down the back of the leg. And it's usually going to start here in the buttocks. So that's where that sciatic nerve comes out. Right? So it's not coming out down here. Okay? Because it's not really, at this point here, it's still nerve roots coming out. It doesn't actually form the sciatic nerve until you start getting down into closer to the pelvis. So now here we'll talk about the different tracing the sciatic nerve. So like I said, here at this point, it's still nerve roots. And they haven't actually come together until you get down into here. It comes out the back side. So here it comes out at the sciatic notch. I think there's another slide. Well, and then it goes between the greater trochanter and the ischial tuberosity. So it's going to be down into this area here. It goes behind the hamstrings, goes behind the knee, and then at this point it splits here, and then that's where you're going to have this nerve that goes around the head of the fibula. We'll talk more about later when you have fibular problems, you can injure that nerve. So that's where it splits into the tibial and the peroneal nerve. All right, so then if you remember in the neuroanatomy, the spinal cord itself actually ends around L1, L2, and you have the, what's that called? Well, conus medullaris, which is the spinal cord. Like you have this. So this is the conus medullaris, and then you have this final terminality that goes down to the coccyx. And then you have these, there's the cauda equina, right? So when you get disc herniations like L4, L5, L5S1, there's no spinal cord left there anymore. You're actually just talking about these. Like here's the end of the conus medullaris right there. So then here, these are all just nerve roots there. And then they exit out at the appropriate level. So we mentioned before that there's the femoral artery, and that can be a serious injury. If you rupture that femoral artery, you can bleed out pretty quick. When we get into the hip, there's going to be issues of vascular supply to the hip. There's actually a small artery that comes through this ligament in the actual hip joint itself. We'll talk more about that, because then you can have issues of avascular necrosis. When we talked about avascular necrosis in the navicular scaphoid, it's also important in the hip. All right, then just to review these pelvic bones again, you have the sacrum, the innominate, which consists of the ilium, the ischium, and the pubis. And then basically, when you're weight bearing, you're transferring weight up the femurs through the pelvis, through the SI joints, into the sacrum and up through the spine. So weight bearing problems typically will affect the knees, hips, pelvis, lumbar spine. And then, like I say, then you have the sacroiliac joints right in here. They transfer the weight up through the pelvis into the lumbar spine. And obviously there's differences between the male and the female pelvis as far as the birth canal and things. Now the sacroiliac joint itself, there's more motion in kids, and then that tends to freeze up as you age. And then here again, we have the joint for the symphysis pubis, and then you have the sacroiliac joints here. And then the sacrococcygeal, it fuses from as you progress from childhood to adulthood. And then this you don't really need to know about in the notes and such, don't worry about it. But just so that you understand, when we talk about what kind of range of motion actually occurs in the pelvis itself, we have what's called nutation and counter-nutation. Where you can see is that the sacrum slips forward, and then the pelvis, it kind of, the sacrum tips like this, and then the pelvis comes in like that, and then the reverse is counter-nutation. So there is some movement that occurs in the pelvis, which occurs in a combination of the sacroiliac joints and the pubic symphysis. So you don't really have to worry about knowing that for the quizzes or anything, tests in this class. So then we talk about the ligaments. What's this here? The anterior sacroiliac. And then that's the one where we're doing, to stress those ligaments, you're doing that anterior gapping test, pressing out like that. And then here, so what's this here? As far as the bone? This? So what do you call this ligament? Sacrotubus. And then what's this here, as far on the bone? It's the spine, ischial spine. So you have a ligament that goes to that, the sacrospinous, goes from the sacrum to the spine. Actually, would be right there. Okay. Then we get into all the muscles. I'm just going to go through these real quick. You have like the ones that extend the hip, and they also extend the back. You have the gluteal muscles, gluteus max, medius. So you can see how here it's a little bit more lateral. So let's see, this is the right leg. So when you do that Trendelenburg test, that muscle here is going to contract to raise the pelvis on the opposite side. If you have weakness, it's going to drop like that. And then the gluteus minimus gets in deeper. And then here's the piriformis. So again, that's what we talked about is a external rotator, because as this pulls the greater trochanter out that way, it's going to rotate externally on the front. And then you have other additional external rotators. Then you have the hamstrings, and then the hamstrings cross how many joints? So it does hip extension and knee flexion. Then you have the adductor group, and those of course are going to be adductors. Sartorius and pectineus. Tensor fasciolata, that will get